All right, so let's talk some more about the skeleton, and I want to start off talking about bone markings. What bone markings are, these are features on the external surfaces of bones, and there's different categories. So these bone markings here, for instance, these are all bone markings that are projections that are sites of muscle and ligament attachment. So they're projections, and they're projections because muscles and ligaments are going to attach to those projections. So let's take a look at some of these. First of all, we have a tuberosity. This is a large rounded projection, maybe roughened. And a good example of this is down here on the tibia. This is called the tibial tuberosity. And again, this is a site where ligaments are going to attach to. Okay, your quadriceps up here, the tendons are going to attach to the tibial tuberosity, and ligaments are going to attach there as well. Okay, then we have a crest. A crest is a narrow ridge of bone. A good example of this is on your hip bone, your iliac crest, and you can palpate this. Actually, you can palpate that as well. And another one is a trochanter. These are very large, blunt, irregularly shaped processes. And the only place that we find these is in the femur, where we have the greater trochanter and the lesser trochanter here. And again, these are sites of muscle and ligament attachment. And then lastly, we have a process, and this is a vertebra, and this is the spinous process right there. Again, muscles and ligaments are going to attach to it. That's why it's there. All right, these next bone markings, these are projections that help to form joints. So first of all, we have a head. And this is a good example here. This is the humerus, and this is the head of the humerus, which forms the shoulder joint. Then we have something called a facet. A facet's a smooth, nearly flat articular surface. And articular just refers to joint. So it's a smooth, nearly flat joint surface. And this is the first vertebra, C1. And on the anterior side, you have these nice, smooth surfaces there called the superior articular facets, and that's where the head's going to sit on. Then another one is a condyle. These are rounded articular projections. And the knee joint has some of these. So here's the tibia, and here's the femur, and they kind of peeled the femur back there. And these are the femoral condyles. These are rounded articular projections, and they form joints, guess what, with the tibial condyles down there. These last ones are depressions and openings, and specifically for the passage of blood vessels and nerves. So foramen is a round or oval opening through a bone, and a large foramen is on the inferior side of the skull. We have the foramen magnum, and what's going to pass through there? The spinal cord's going to pass through there. A meatus is a canal-like passageway. This is your external auditory or acoustic meatus. That's your ear hole. And then we also have fossa. Fossa is a shallow basin-like depression in a bone. And up on the temporal bone here, we have the mandibular fossa, and that's where the mandibular condyle is going to fit in and form the temporomandibular joint, which allows you to talk and chew.